Hi, I'm Dr. Alex and I'm a doctor of chiropractic. Do you work in an office constantly sitting by your computer? Or quite recently, maybe you started taking up quite a bit of tennis. Have you started developing pain in your upper forearm? Well, chances are you're suffering from tennis elbow. Tennis elbow, or lateral epicondylitis, is a condition that causes pain on the outside of the elbow. Tennis elbow is usually caused by overusing the muscles that are attached to the outside of your elbow. These muscles are used to straighten out your wrist. Now, if these muscles are strained, it can actually cause tiny tears and inflammation in this general area on the outside of the elbow. Now, as the name suggests, it can be caused by playing tennis, but basically any activity that causes repeated stress to the elbow joint can cause this condition. For instance, sitting a long time in front of your computer, constantly working with the mouse button can also cause tennis elbow. So basically any repetitive movement where we extend the wrist can cause tennis elbow. At first we might experience pain, such as burning pain, or an ache along the outside of your forearm and elbow. But with time, typically what will happen is that the pain will start getting worse. And if you continue to do this activity that is causing the pain might actually start spreading down towards your wrist, and you might even have pain even during rest. Tennis elbow usually lasts between 6 to 12 months, with approximately 90% of people making a full recovery within 1 year. However, there are things you can do yourself to speed up this recovery time. Firstly, the most important thing to do is to rest your injured arm and avoid doing the activities that keep aggravating the injury. There are also simple treatments that you can do to help with the pain, like cold compress, for instance a bag of frozen vegetables from the freezer, and keep it pressed against painful areas. The cold will help dampen the inflammation of the muscles and give relief. Important here is to not place the ice pack or the frozen vegetables or whatever directly on the skin, but to first wrap them up in a towel, because then we'll avoid having ice burns. Secondly, and very importantly, you can speed up the recovery time by doing rehabilitational exercises. And these exercises we're going to do together now, so I'm going to show you. Okay, so the exercise that we're going to go over for the tennis elbow is a pretty basic one. So all you need is a chair or something to sit on and an elastic band. So what you do is, let's say it's the right shoulder, take the elastic band like this, you step on it, and what you do is you can have quite a bit of pressure here or a bit of stretch. And what you want to do is you want to be as relaxed in your elbow as possible. Typically what I do is I lean forward a little bit like this and keep about 90 degrees. And then what we're going to do is we want to work with the muscle that extends the wrist, which is this muscle right here. Now what we want to do is we want to focus on the eccentric part of the motion. So we don't want to focus on the concentric part, which is when we push up like this by ourselves, but we want to focus on resisting going down. So what we do is we help up like this, and then release, and then slowly down, resist, all the way down, help up, very important, help up, slowly down. Now if we do have tennis elbow, this might actually be a little bit of pain when we do this, but that's completely fine. Now if we don't have an elastic band, what we can do is, if we have a bottle of water or a heavy book or something that we can grab, typically I don't recommend this as much, but same principle here. So hold it, help up, slowly down. Now typically what I recommend is 3 sets of 10, so do 10 repetitions, rest for a little while, 10 more, rest, 10. And if you can do this several times a day, that would be a lot better for your situation.